As a result of the information exchange portal, healthcare will be better and lives will be saved, and that's what we're proud to be a part of.
It's the pioneering achievements that inspire us at PCCI. Something with enormous humanitarian purpose, or social campaigns that eliminate a whole disease. The Voyager mission, initially intended just for a few planets and now reaching beyond our solar system, or finding the molecules of our inheritance, DNA. In US healthcare, actually in healthcare across the world, there are huge problems to solve. The system is complex, it's fragmented, it's overloaded. Many times patients just feel alone and disconnected, and providers themselves can't communicate as they need to. We're building the IEP with the patient at the center and the intelligence to communicate all of their needs to everyone in their network so that no one ever falls through the cracks.
Not being connected fragments services, it fragments families. It makes a lot more complicated basic activities of life.
We see a lot of patients who don't really have a full story a lot of times.
And just negotiating the world to get down here can be a big step for them.
I just send them down that street and don't know what happens to them from then on.
We often don't give enough significance to what I call the chronic daily disasters that patients experience. The inability to control diabetes, to prevent an infection from getting worse, even to get the basic medicines they need to control their blood pressure.
The IEP can give doctors and social service providers the most up-to-date information that they need to help patients manage a disease like diabetes before it becomes chronic.
The idea for the IEP came out of a patient encounter I had in 2008. It was an elderly man with severe hypothyroidism, and he didn't have any family. And he was admitted to the hospital at this point 6 times for the same condition. And we talked to him and got his permission to call places around Dallas, shelters, community organizations, and when we found the shelter that was taking care of him, we said, you know, it's only a medication that's less than $1 a day that he needs for hypothyroidism. And they were overjoyed because they'd never received a phone call or that kind of information. And since that point forward, he's had no readmissions to the hospital. And that's when we realized, imagine if we could connect organizations across Dallas with this kind of information.
So in Dallas-Fort Worth, there's hundreds of hospitals and more than 10,000 physicians and 6 million people.
It's not feasible to sort through thousands of medical records in the amount of time that physicians and social service workers have to deal with the people whom they're trying to serve.
What we really need are solutions that help us bring these types of information together.
There is no best practices system for sharing this kind of medical and social information across a community. And this particular project through PCCI has the greatest potential to create that kind of model that can then be replicated across the entire country.
We want to protect the patient, so we're innovating in privacy and regulation as we build our IEP, not after we build it.
Imagine a patient like mine. The IEP would connect information from all the organizations he had visited, hospitals, nursing homes, clinics, shelters, community-based organizations, to make sure that what needs to happen for the patient actually happens. How would you manage that data? Once you connect it, you have an overwhelming amount of information, which calls for intelligence on top of this network. Pieces will sit on top of the IEP platform and interpret this massive amount of data in real time at the point of care. Pieces reads the notes that doctors, social workers, nurses write in their records. It interprets them, translates them, determines the correct disease, all in real time.
The amazing thing about Pieces is that it's actually able to look at patient data and predict what is going to happen to the patient and actually prevent it from happening.
Pieces will alert the care team that a patient's about to have a critical event, like having a readmission or missing an appointment. It takes all the data in the system, no matter how vast, and summarizes the relevant information into a single one-page document called the ICCD. It's going to help people right on the front lines.
Providing the right information to the right people at the right time can really save lives. It frees providers to do what they do best.
The information exchange portal would help break down barriers. We would know what their health needs were, whether they were dietary needs, whether they were medical needs, social service needs, and we would instantly connect them.
And to have that access would be life-changing
So what we're talking about here is really leveraging all the investment we've made in health information technology to really move us to the next stage of healthcare.
We know we have a moral and ethical responsibility to the patient as we build this kind of engineering, and that's really important to us.
The first thought we had regarding the IEP was that this is a no-brainer. It is a wonderful way for organizations, forward-thinking organizations, to really start enhancing the lives of the people we serve.
If we can really empower patients in this, give them control over their care in a way they've never had, it's going to be extraordinary.
We know that a lot of people are going to still be living tomorrow because the information exchange portal is here today.